kids. So if you get that, if you hear that message, that is what we're up to. And we'll try to post it online too for anyone who wants to see it. Awesome. So Dr. G, we have Riverton, Cheyenne, Rock Springs, Jackson. Yeah, kind of represented around the state. So I think maybe we may get a few more folks who kind of join us as we chime in, but I think Dr. G, to honor your time, we'd love to have you kick us off and just give a little bit of an update from your perspective in Lander of what's happening and what you're thinking about in response to COVID-19. So thank you for joining us.
Oh, you're welcome. Thanks y'all for joining. So as you know, Fremont County's been pretty busy. We had not the first case, but the first big group of cases. I think we have 25 cases as of this morning. I haven't seen any updates yet. And Laramie County and I think Teton County have just recently passed us as far as number of cases. So we're working real hard in our healthcare system to try to help take care of people. We do have some pretty seriously ill patients that are actually younger, you know, under 50. So we have to remember that it does affect all of us of all ages, but we're most concerned about trying to protect our older, you know, our grandparents and our older parents from this. So we're working real hard. I'm up for any questions. If you guys want to do that, I can probably answer questions better than tell you things. So go ahead and we can answer some questions.
And for those of you who are new this week, we're going to do the same format as last week. Mandy and I have come up with some questions, but we encourage all of you to ask questions in the chat box. If you can just say where you're from. I know you already said that, but just so that we can not have to look back up and we can say so-and-so from Riverton or whatever has this question. You all had great questions last week. But Mandy and I can start us off. So I think one of our questions we're trying to ask every speaker in this series is if you could share sort of a story where you had a time of similar uncertainty in your life or career, and how does this compare to that time?
Wow, I think I've probably had a couple different times. I think I was a mechanical engineer before I decided to be a doctor. And so I had definitely some kind of personal and philosophical sort of discussion with myself at that time is, should I continue on this path or another path? I also had a cousin who I was pretty close with who died suddenly. And that was also a big philosophical sort of moment. But really, truly, this is pretty huge as far as what's happening right now in all of our lives. You know, we have had a huge change as far as what's going on in society, what's going on in medicine and politically. So this is something that I think all of us, all ages, are dealing with, something that none of us have ever dealt with on this large of a scale. So, and I think that's an important thing to remember as we work through it, to try to reach out and support everybody that we can, because I think we're all going through this in different ways, and there's a lot of uncertainty for all of us right now. But I think if we keep forging ahead, you know, this too shall pass, but sometimes it's hard to know that when you're in the middle of it, so.
Yeah, absolutely. And I think, what do you think in terms of dealing with sort of the hysteria, especially from a medical perspective? I mean, it's pretty grim to read the news, and I think a lot of us have trouble, especially younger people, just the many influences in your life, sort of how to decipher, you know, how to deal with it, how to decipher all of the information, and how seriously, I guess, to take it, and what sort of actions can we even be taking?
Yeah, I agree. I think it's hard, and especially you all are much better at the 24/7 information world than I was. I didn't have that growing up. And so we were a bit insulated from things like this, and you all are seeing it on real-time basis at all times, and it's hard to filter that out. I would say it's, if you can, to look at different sources to make sure you're getting different sides of stories. As far as medically, I try to really focus on what you're hearing from, like, you know, the CDC or your local public health department. I think most people are trying to, like, give you straight answers from the medical world. And so I would go there first for information about what's happening in your communities and what are some of the things that we can do. You guys are probably all very sick of hearing about physical and social distancing and self-isolation and all that, but it's really important. And when you think historically, these are historical ways that we used to fight diseases, like, you know, the influenza epidemic in the early 1900s, or the plague way a long time ago. And right now we don't have the ability to have a vaccine to help us. We don't have any treatment that can really help us. So these things that we can all do as personal citizens, as members of families and members of schools and communities, these are really powerful tools still, even though they're quite frustrating to feel like you can't do things for 2 weeks or 3 weeks. It's really important to try to think about holding that course if you can.
Mm-hmm.
Dr. G, I have a question. I imagine you've been watching this for several weeks and months, and you've seen the rise, and even Lander kind of taking off as one of the early community spread locations. How have the things changed that keep you up at night? So maybe what kept you up at night a month ago, and what's keeping you up at night now that you're worried about sort of into the future?
So I think before all this started, Mandy, I think the thing was just if we were getting enough information out there. We did a lot of talks throughout the community with the schools, the superintendents, the local politicians, to try to prepare people when we were seeing stuff happening out east or in Washington State, and just trying to think about, like, are we getting enough of that information out? And then, you know, when it really started to hit in Lander, it was like, are we doing the right thing for the patients, you know, along with that? And so, I will tell you, and I've talked to Dr. Mel Meyer, who's a good friend of mine, and we talked about all this information we're getting, and it's constantly changing. You all are seeing all this changing information in healthcare. Every 2 days, there's something new we should be doing, either from the national or state level. And one thing that I found that helps me is I've offloaded it to some really good friends who are really smart. My fiance, Era, has been helpful, but also two of my retired medical friends, Dr. Bill Calder and Dr. John Klinkenberg. I asked them to help me try to absorb and process some of this information. And that's been way helpful. And actually, since that has happened, that has allowed me to rest easier, thinking do I have to read more tonight? And it's 2 in the morning, like I got to get up. And so for you all, that if you feel like your information overloaded, maybe you ask your friends. One thing that helps us when we're looking for concrete information, when we get anxious, our brain goes to a certain part of our brain called the amygdala, and it makes us more anxious. And if we can get into our cortex, into the thing that's trying to figure out facts, that can help kind of dissipate some of that anxiety. So if you feel overloaded, reach out to your friends and your family to see if they have what they've heard and some of those things. And sometimes that can help you. So I think for me, that's been a big thing that's helped me try to like offload and let me sleep easier at night, for sure.
Awesome. And how are you feeling about the PPE? I know it's something we hear a lot in the news of shortages and people at home making masks. How do you feel about it from kind of local Fremont County perspective on where that sits?
Yeah, I think it's the same here. We're trying to prioritize the PPE for all the healthcare providers, because they're on the front lines. The nice thing about the mask, I think there's a lot of volunteers helping to make masks. And of course we want the mask to be safe. So I think initially the CDC said only people with a cough should wear a mask. They haven't changed that, but I think they're looking at that closely. And I think if one of you gets sick and you call a doctor and you have a fever and they say you should self-isolate in your home, it can be helpful if you're ill to wear a mask, and that might prevent some of the droplet spread to your family. So I think we're going to see more of that, where we have more people in the community wearing masks as a recommendation. And I think if you see somebody with a mask on, give them a high five from 6 feet away and say, "Hey, good job. Thanks for keeping your droplets to yourself." And so I think if we can erase that stigma, I think that's an important thing to think about. But it is an issue. PPE is short, and there's lots of people sewing gowns and masks in Fremont County, and I think around the country. So,
just a quick reminder for our audience to please ask questions in the chat box. Any question is a good question.
Yeah.
Yeah, and I had read an interesting article recently that, we said we didn't need masks to save them, but then the stigma that becomes attached to anyone wearing a mask is sick. And so then nobody wants to wear a mask and be deemed one of the sick people. And so I think it's just, there's a lot of layers to this, both physical and emotional response and community perception. So it's interesting to see that evolving.
Mm-hmm.
Yeah, and it looks like Jasmine from Riverton has a question, sort of a technical question. If about the statistics reporting, if there is a death from, pneumonia and it's not known, maybe it's assumed to be something else, someone with underlying conditions, but then later tests positive for COVID-19, would that be included in the statistics of, a coronavirus death?
Yes, it should. And so there have been talk about that, that since tests are limited, some people that get into the hospital are often tested to see if they're positive. That way the hospital can determine who can take care of them, if that makes sense, that they have a positive area and a negative area, so they can still take care of people that are suffering from other things. And so if we have an absolute positive, that would be included in those statistics. I will say that some people will potentially die of pneumonias that may or may not be this, and they might not get tested. That's a little bit more difficult to see where that falls in. I think there's discussion on how best to track that, like on a national and state level, to see what the actual influence is. And I would also add, Jasmine, that's a great question, and we're wrestling with that. If we think about the actual numbers that we see in our state right now, like I think Fremont County has 25 positives, we probably have at least a number of hundred of people that are calling that we've connected with either at the clinics or in public health that have fevers and cough. And we're trying to count those in those statistics as well. But there's a lot more people than that even that have such minimal symptoms that they'll never be counted at all. So I think our statistics are difficult to wrap around. It's not going to be as accurate as we would like to have, based on issues we've had with testing, and then also the ability to have a certain number of tests. But also a lot of people, especially young people, will have illness, but it'll be so minimal you might not think of it any more than just a common cold. And those numbers will never be counted, but it's important for you to all think about that with your peers, to know that even if you have minimal symptoms, there's still a chance to spread it within a family. So to be careful. And that's where the social distancing and self-isolation and stuff has been the important recommendations, especially for younger, healthier people. So. Yeah,
absolutely. I know pretty much all of our cases in Teton County have been late 20s, early 30s. And the only symptom that's been reported is a loss of the sense of smell and taste.
Yeah, that's an interesting one. That's that this thing affects the neurologic aspect, and we don't fully understand that yet. But that is one of those, like an acute loss of smell and taste is one of those things associated with this illness. So.
Yeah, it looks like Kennedy from Rock Springs has a question, sort of about your perspective on the political scene affecting the response to the virus, and whether you think this might have been different if it happened, 5 years ago, or different if it happened in 5 years from now?
That's a fantastically difficult question. And from a public health standpoint, the answer would be really easy, right? Like, we should just shut it all down, and we should all just hang out for 2 to 3 weeks, and we should not do anything. Ideally, right, that's harder to do. And we've been talking about this a lot. Like, I think America, and maybe Western democracies, but especially in America, I think we really treasure our freedom, and we treasure our Constitution. And when you think about how difficult it is to have somebody tell us what to do, even in your own homes, probably, right? When your parents say you need to do this, it's hard. But think about it from the standpoint of your governor telling you this, or your president. It's a difficult thing for us to wrap our heads around, because we have such a strong sense of freedom here, and we appreciate that freedom. And that makes it difficult politically to have people stay at home. And there's a lot of nuanced things between business and medicine and politics. So it's difficult, and you might be right. Maybe if it happened, 4 years ago, the initial response would have been different. I will tell you that that the initial testing was unfortunately wasn't as good as what the CDC thought it was going to be. So that caused some issues as well. And I think people just thought like we could take care of it, you know, how they started to like isolating people. And but the virus has no boundaries or political or boundaries in that. So I think that's the bigger issue that I think we're learning. That my hope would be after this is all said and done is that we become a more globally connected world. We think that happens, and we understand that we're so globally connected that makes it easier to transmit disease. But if we can become more globally connected, and you as young leaders might be those people that help to get us more globally connected, and to make sure that we still reach out to other countries and other states, and that we're all in this together. So it's a great question, and I think there's going to be some of your probably graduate theses and master's theses will be written about what happened in 2020 with COVID for sure.
Yeah, definitely. Another sort of going back to a more technical medical question, Jack from Jackson wanted to know your perspective on the new FDA approval of malaria drugs for COVID-19.
So some of that, I think, you know, so I'm not doing the clinical as much. I have to be more in the political realm, which is new for me. But there has been, so there's some data with some of these drugs from SARS-1. So when SARS came through, the first SARS virus, they did some studies with this, and it works on a certain thing called an ACE2 gateway. That's how the virus gets into cells. So I think that there's some historical knowledge that this might help for this type of virus, and I think that's where it's being utilized. I think in Fremont County, they're utilizing it for the sickest patients. I'm not sure if they're utilizing it on an outpatient. I think currently it's only for hospitalized patients, but I haven't kept up on that completely, but that's a great question.
I guess, yeah, maybe we
have a couple.
One more question, or at least one more question.
Yeah, a couple more. Yeah, well, maybe let's do the two more that are in the chat box, and then we'll let you get back to your crazy world, and we'll throw it over to ET as well. But one of the questions from one of our students in Rock Springs is it true that the virus could return back in the fall, or we see another big surge in the fall? What are your thoughts on that?
No, that's a great question. We actually might not see it go away this summer. We don't know that yet. And I think that's the concern, is that, you know, we're trying to slow the disease process so that we don't get large numbers of patients all sick at once. But by doing that, you all have heard about flattening the curve. By doing that, we sort of prolong that disease process, because as we start to do more stuff, some of us will get sick and exposed, but it's more to try to prevent the really sick people from coming all at once so the hospitals can take care of them. I don't know if we know if this virus will go away in the summer yet. We don't know that. We hope so. That would be really helpful, and that would give us a break, and maybe we could get a vaccine in place, you know, kind of like influenza and stuff like that. But no, that's a great question. We don't know 100%. We're hoping that it goes away, but we might still see some of this all through the summer in different places around the country. So.
And how about kind of relatively similar to that, Brent had a question about the apex, or if we've all seen those, you know, big bell curve charts. Do you have any personal thoughts yourself on when Wyoming may hit the top of that relative to hospital beds available, or is it just nobody really knows?
I think it's a best guess based on kind of what they're seeing elsewhere, you know, what those curves look like as number of positives happen in a certain area. What I've heard from different people, Dr. Justin Hopkins used to be in my role. He was here, but now lives in New York, and he's taking care of a lot of patients in upstate New York. And he thinks their peak is going to be still another couple weeks away. So if we think about that, and we think about the progression coming across the country, it would not be unlikely, we don't know, but it might still be 2 to 4 weeks before Wyoming sees their absolute peak as well. So we'll see. So I think you're right. I think it's a bit of a mathematical guess based on, you know, different sort of, you know, generated patterns in that. So I think we're hoping it slows down and plateaus and goes away, but I think a lot of us in healthcare are starting to think like, what's the next 2 to 4 weeks going to look like for us as we work through this. So
Great. Well, Dr. G, thank you for joining us, and thanks for your candid answers and your expertise, and for all your hard work in managing it in Fremont County and looking out for people. So thank you very much for joining us.
Thanks a lot, and you all have a great day. And if any of you want to go to Wyoming to go to med school, we'll see you someday probably. So talk to you soon.
Thank you.
Awesome. Great. Thank you. We'll see you. Awesome. Thanks, you all. Really great questions. Again, thanks for your thoughtfulness and for chiming in and asking what you're curious about. With that, I think we'll hand it over to our round 2 speaker, who is ET from the Array School of Design and also heading up a technology coalition focused currently on COVID-19 and response to that, and hopefully well into the future focused on many other things as well. So ET, I think you're muted. I'll let you unmute yourself. Yeah, perfect. And then you can take it away, and if folks want to chime in with questions as well, we'll do the same exact thing. Michelle and I have a few questions, but we'd love to have your questions instead of our questions. So ET, tell us a little bit about yourself.
Well, hi everyone. First of all, how are you all doing? Family-wise, healthy-wise, all that stuff? Good, yes, because as you know, Dr. G said earlier, I think it's about to get a lot worse. And so, you know, that social distancing and us maintaining space and working proactively right now prior to this peak is really important. So, you know, I'll definitely keep my background and experience brief so we can have as much time as possible for you guys to ask as many random and questions that you have. So my name's ET, born and raised here in Cheyenne, Wyoming. I moved to California after high school. So I worked for Apple for about 10 years in San Francisco, Los Angeles, New York City, and Chicago. Moved back about 5 years ago. I started Wyoming's first technology and design school about almost 4 years ago, and that's what I've been primarily doing. And most recently, I am now the founder of the Wyoming Technology Coronavirus Coalition, which I created about 2 weeks ago with the idea of bringing anywhere from 20 to 30 people in technology together to start coordinating and working on efforts to help the coronavirus pandemic. And our community has absolutely exploded. We have over 200 members from almost every single county around the state of Wyoming. I have a bunch of folks from around the country, and we also have people from around the world that are contributing ideas on topics like 3D printing, sewing, using something called, has anyone ever heard of, what am I doing upstairs right now? It's called Fold at Home. And so there's an international scientific organization that you can use your computer's resources, like your processing power and your graphics power when it's not being used, for these supercomputers around the world to send packets of data to your computer for them to be able to understand. Initially, the program was designed to understand how proteins in cancer, right? So that we can move towards a cure of cancer. Now they've reshifted all of their organization and their resources to understanding the proteins and the coronavirus itself, and exactly how this virus is mutating, how it gets into our cells, and anyone's idle computer can help these supercomputers from around the world to better understand how this virus is spreading and how we can eventually come up with a vaccine to kill it. So really the coalition's objective is how can we, by using technology, help and save as many lives as possible. Again, the reception and the interaction has been absolutely fundamental. About earlier this month, we have about 23 active 3D printing sites around the state of Wyoming. So the University of Wyoming has been an absolutely incredible partner of ours. They've turned on all of their idle 3D printers. On Monday, we delivered over 110 3D printed masks to the local hospital here in Cheyenne, CRMC. We are now printing face shields and tubes. One of the things that's unfortunately is happening is we're getting a bottleneck of swabs and testing kits available to actually do the COVID-19 tests. And these things are very simple plastic. And so luckily, a couple of our folks around Wyoming have what are called 3D scanners. So they're scanning these things. We're refining the 3D model so that we can be able to send these prints all over, not just Wyoming, but all around the world, so that we can continue this testing. Because one of the things about the manufacturing process, especially with technology, if we know that we may hit a peak 2 or 3 weeks from now, we have to be printing that stuff right now. We can't wait for CRMC to go, hey, we're out of masks. Hey, we're out of swabbing units. We need to know, how many do you have left? Because, for each of those 3D printed masks, which, I am by no means a medical trained professional doctor, and very few people on the Wyoming Technology Wyoming Technology Coronavirus Coalition. It is quite a mouthful. That's why I just call it WTCC. It's a lot easier. We do actually have a few folks on there from the Wyoming State Department of Health that are helping advise and working with the CDC to see, are these effective? We don't have a lot of time to test them, and so we're unfortunately in a situation that in a couple of weeks we might have to pick our poison. You either have no certified masks and things to keep you safe, or you might have something that could potentially help, but we can't promise anything, like if you want to use them, great. And so that's kind of what our coalition is doing actively right now, is we're reaching out to the State Department of Health. We are turning on folks in the community around the state and talking with their hospitals about letting us know how many of supplies they have, so we can start manufacturing these things as much as we can. So we're working on a lot of that. You keep hearing this acronym PPE, which is personal protective equipment, because one of the largest threats right now is that our healthcare workers, who are literally on the front lines of this virus, right? Those doctors, those nurses who are actually out there swabbing, if they get it and they go down and they become sick, that's when this thing really starts to take a turn for the worse. So for example, here at Array, so our school, my business partners are Amy and Dan Surdam. And Dan's a doctor and Amy's a nurse practitioner in the military. And they own 3 clinics, one here in Cheyenne, one in Laramie, one in Wellington. And right now, Amy, my business partner and nurse practitioner, they have an RV outside of their clinic. That's where anyone who is potentially infected, and Amy is the one doing all the swabbing. So people stay in their cars. She has her stuff on. She's swabbing for these tests. I think we've gotten 15 or some positives. Unfortunately, as kind of the doctor said before, the testing thing has been a massive mistake for this kind of. We were completely which all of us have been completely unprepared, right? No one was expecting how our lives changed 180 degrees in the span of literally a month, right? And what she's terrified about is not only she's the one doing the testing, so her risk of, what are they called? She's called what's called a vector. So the term vector means that you have a very high probability, regardless of your age or underlying health conditions, that you will contract it at some point because she's the one swabbing. And so she has, excuse me, I smoke. So that's a cough. It's my smoker's cough. I promise. Don't smoke. And so she can't, when she goes home, because she's a high vector, she can't hug her kids. She stays down in the basement, and they bring her down some food. Dr. Dan Surdam is going back to Austin, Texas. He's about to work in 11 days straight there. And she's also very worried about him contracting it. So it's a really difficult time. And so that's one of our passions at the WTCC, is ensuring that these healthcare workers have access. I mean, we all need masks, right? And you guys have probably read, and the doctor talked about it earlier today, that everyone actually, even if you're healthy, should wear masks. It's one of the things that the Asian continents were doing from day one, is like everyone was required, because not only, now they're saying that the virus can incubate for up to 12 days. Right? So you could have been exposed to COVID-19, 9 or 10 days ago, and you still might feel fine. But the most dangerous thing about this virus is that during that, which you guys have probably all heard, while you're this called asymptomatic passing. So I might have it right now. And if I go out and I talk, I feel fine. I don't have a fever. I'm not coughing. I don't feel shortness of breath. I could be, and that's why it's spreading so fast, contracting it and passing it on to other people. So to kind of end, because I want to give time for questions, Right now, obviously, we're working very hard on 3D printing and manufacturing. One of the very cool things is there's a large company in Wyoming called Manufacturing Works, and they are quickly, which we just had a conversation with them yesterday, they're going to potentially put in a significant amount of money into the production of PPE equipment using technology like 3D printing and CNC machining, which this is a great time for you guys to learn all these tech terms, right? CNC machining, 3D printing. 3D printing is what's called additive manufacturing. CNC machining is subtractive manufacturing. So while you guys are at home, look up these things because they're really important, and all of us in the world will know about them. You know, we just did a medical supply drive in Laramie, so some of our members in Laramie, and what they were able to accomplish yesterday, we were able to deliver to Ivinson Memorial in Laramie. I have the data here. They were able to deliver 33,930 gloves, 529 N95 masks, 282 other types of masks, 123 safety glasses and goggles, 118 gowns, and lots of sanitizer wipes, disinfectant, biohazard bags, and boxes. So that just happened literally yesterday. And so now we're obviously working on the folding at home and using, again, technology to help understand the genome and the proteins that are involved. And everyone is helping out. So I'm just like, wow. I'm just blown away by the community coming together and using technology to solve this very serious problem.
That's awesome. Yeah, some amazing work. I have, I guess, one technical question. And again, for the audience, please, any question that you have is a good question. I'm interested, you know, I think the medical supply, medical device industry is notoriously heavily regulated, maybe. I'm wondering how that's working with sort of this rapid production of medical technology that's not going through, you know, iterations of testing and FDA approval.
Yeah, you know, and that is a question that continuously comes up in the coalition's conversations because, you know, obviously we don't want to provide PPE equipment from a 3D printer that's already infected or is ineffective or actually is making the situation worse, right? You know, because one of the things about masks that they've been talking about, there's a psychological effect. When you wear a mask, you feel safer. But is it actually safer? You know, and this is again where I think that what's happening today, there's two things that will never ever be the same again. The world will never be the same again. We are discovering how some of these process, like obviously having the CDC and ensuring that and doing rigorous testing, right, to make sure that, because like, for example, when you actually get fitted for an N95 mask, you have to go for an hour session where they actually make sure that it is form fitted to your face. This is one of those things where we've done a lot of things old school. So when I saw that article, I was like, here's the thing, you know, if you have a modern day technology now is so powerful. Well, if you have like Face ID, right, you've got a 3D scanner built in right in the front of your phone on most modern phones today that can do an accurate 3D scan of your face. I mean, if it's accurate enough that you can use it for security and for logging in, how amazing would it be to have your phone be able to scan your face and have a mask 3D printed that would custom form fit your face? Those are the questions that we're thinking about. And obviously, that's unfortunately not probably going to be possible by the time that we actually get through this curve. And so right now, I think what's happening is we just got to do the best we can. Everyone is kind of flying by the seat of their pants right now and just doing what their gut is telling them the best thing is to do. And when this is all said and done, I think there's going to be a lot of change in the processes and the practices. And yeah, it's a tough one. It's a super tough one. And I know even everyone at the higher ups in the Department of Health and CDC are asking the same questions. Like, we want to maintain the security and the safety as much as possible. But the problem is we think we have time.
Yeah,
maybe similar. Oh, sorry. My Zoom just fast forwarded like 20 seconds. I was apparently behind all of you. I'm curious, the question we asked Dr. G as well, does this feel like any other time in your life that you have faced in the past? In maybe in what way, yes, or in what way does it feel different or unprecedented?
Yeah, you know, I think that there's only one instance in my past. So the long of the short of that one is when I just became a leader at Apple. This is back in 2007 and 2008. So if any of you are familiar with what happened in between 2007, 2009, I had just become a new manager, and boom, the economy crashed, right? We had that big stock market crash, and we were terrified that we were going to be losing our jobs. And I remember Steve Jobs had emailed all of us and had said, all Apple leadership is to report to the San Francisco Giants Stadium in 3 days. We're going to talk about how to manage this crisis at that time. And literally, I just remember how some, because Apple was like, all of us working at Apple were like very pippy and like, oh yeah, cool, you know, saving the world, building cool technology. And I remember getting to the San Francisco Giants Stadium, and it was very silent and very somber, because we were expecting either that we were losing our jobs and or we were going to get marching orders to go back to our teams and lay a bunch of people off. You know, and obviously you guys saw that in the last month, 6 million people have filed for unemployment, which is the highest ever since the U.S. started tracking unemployment rates. You know, so we were just as terrified about that number. And I remember I was expecting either Steve Jobs or our director of HR, Denise Young-Smith, to come out and talk to us. And in that moment, there was a stage that was right in the middle of the stadium. And so the lights kind of go down, and then the lights on the stage turn on. And Steve Jobs didn't walk on the stage. Our director of HR didn't walk on the stage. It was actually Idina Menzel, which some of you may know, as she's an amazing singer, Broadway performer. And at that time, the Broadway musical Wicked was a huge hit. Everyone was talking about Wicked, 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 Wicked. And she got on that stage and she sang the song Defying Gravity. And everyone in that audience knew exactly the message that Apple was trying to send to its leadership team, right? And then after that, our director of HR came on and she said, that's the theme. The theme is, you know, there's so many things that we cannot control, right? And that's what it feels like right now. There are so many things that we cannot control. All we can do is to do our best to defy gravity. And it just sent this like shiver down my bones. And at that moment, I was like, I love this company. I will be with Apple and I promote Apple for the rest of my life. And that's kind of what it feels like right now, right? That there's all of this news and this press. It's, you know, unfortunately not good news, and it's not going to get worse. And you can really easily get into this dark spot. You just need to realize there are a lot of things that you can't control. That's okay. But there are a bunch of things that you can. And when you start to focus on what can I do to defy gravity and change things and change direction, you start to get a little fire is burning in your gut. And then that fire gets bigger and it gets bigger. And you start spreading that fire, kind of like the virus, but in a positive way. You start spreading that to other people, right? And so it's really important that in that moment, the only difference I would say is, you know, people were losing their jobs and people are losing their jobs today. At that point, we were not looking at 120,000, 210,000 people that are expected to die from this in the next, couple of weeks. And so that just adds another level of severity, but also for me, another level of a sense of urgency to be able to do something and make change as quick as we can, but also making sure that we're staying safe at the same time.
Absolutely. Yeah. And I think I was going to ask you about how you sort of, managed to jump into action amid all the stress. And I think I think you answered that already, which is very inspiring. I know for a fact we have some students here who are in engineering school or taking engineering in high school, might be interested in going that direction. How can people help right now at home or, taking advantage of, I know we have a Fab Lab in Jackson. I don't know how, how can people help? Can you talk a little more about WTCC and how that platform sort of works?
Yeah, absolutely. So right now, so the first way that you can help is we do have a website, which all of us in the WTCC, we're all volunteers, right? No one's getting paid to do any of this. And this team whipped out a website, whipped out this and did all this stuff. I'm just like, whoa, this is great. And so we do have a website. It is wytechcc.com that we are putting a bunch of information about, if you know how to sew, if you have a 3D printer, here are the 3D printing schematics for the masks and the stuff that we're currently using. So there's a lot of resources there for using tech to do it. We also do have an open community. So right now we are using a software platform called Slack to kind of coordinate conversation and communication. Unfortunately, we're going to be moving away from that platform for a couple of reasons. Right now, I just got the bill yesterday. It's going to cost about $2,000 a month based on the amount of members that are coming into the WWC. It's like, so I have to look for some cheaper alternatives that still have the same functionality. Also, when you have a group of people that are approaching over 250, 300 easily, I am trying to distill the noise, right? Everyone's so excited, wants to help. So that's kind of my mission after I'm done today, is really kind of start putting into place like some of our objectives and so on. So since you guys are a younger group, if you play video games, we're actually moving to a new software platform called Discord, which generally is used for video games. But I have to take all of these people and move them onto because the video game community is so active, the platform Discord actually is built for much larger communities. It gives us much more granular control over permissions, new compose. So our youth may find jumping into the WTCC to help out. If you're familiar with Discord, guess what? We're going to Discord. And if you haven't used Discord, it's fairly straightforward. And so what we're looking for is we're going to be transitioning to that over the weekend. So if you guys are interested in helping out, you can simply go to our website. There's a little join now button. You click on it, you put your first name, your last name, your email, kind of tell us why you want to be part of the WTCC coalition. And then I will eventually add you. And then you'll kind of start seeing just how many amazing people are coming together with ideas and making things happen. So you can do that literally right after this call. If you want to help out and you feel pretty tech savvy, jump on in. Let's go.
E.T., I have another question for you, kind of looking future oriented. So you run a coding and technology and design school. And how do you think that this pandemic and economic recession period will shape business in the future? So if these students are in high school or college and looking at what the start to their career looks like, how do you think that will change because of this?
Great question, Mandy. Even prior to COVID-19, I've always been, as running a technology, computer science design school, that's my baby, right? And we knew there were things that were already coming up, that robots in warehouses were more efficient than humans, right? And people were kind of afraid of, these robots kind of replacing jobs and all that kind of stuff. But now when you think about it, robots have a very strong set of skills. They can run 24/7, 365. As long as they have power, and as long as they work, they can be in these warehouses and move heavy boxes, so we kind of reduce the amount of liability of injuries and OSHA accidents happening in these big manufacturing plants. So you guys know also, the self-driving cars have always been this kind of thing, and there's still a lot of things to work out there about driving. So what I think is going to happen is when this is all said and done, there's going to be an even more laser line focus about the use and what are the advantages of technology and robotics that if we had them in place prior to COVID-19, could the supply chain have been able to keep up? Right? My dad actually works at the Lowe's distribution center here in Cheyenne, and he just basically goes into these semi trucks and unpacks boxes, but he's currently labeled as an essential employee. But he's still around 120 other people that are at Lowe's because if those people unpacking the boxes and the pallets aren't there, everything shuts down. However, that exposes him every day, to bringing that virus back into my home and to my mom. And it's this real difficult decision, right? So I really think, I was saying before COVID-19, the language of the 21st century is truly learning how to code. If you know how to speak the language of computers and you can write code, it's kind of people that could read 100 years ago. And I just think more and more people, as we talk about 3D printing, what is it? People are going to get excited about it. People are going to want to learn how to code. And you're going to be able to see how technology can quickly change things and move forward. And so my priority now, obviously knowing that, is school is so important. Being able to go to school and learn these things is going to be more important than ever. And so we're launching Array Online in about a month. So you guys, for those of you who are interested in continuing computer science and coding, we're going to have some options available there. So I think this totally changes the game for technology and accelerates some of the things that we were seeing prior. Now we're going to see it happen even faster. So the opportunity
E.T.,
is huge.
One of the things the governor mentioned last week for those who were here last week was not wasting time. You're not thinking of this as a vacation or time at home that's just gone forever, but to learn a new skill or to take advantage of it as just a break in normal life. If somebody did want coding to be on their list of skills they learned while they're sitting at home and annoyed by their younger brother or sister, what are the steps that you would recommend to just start to dabble in that or to look into it?
Yeah, great question. I think that, right now, like for me, this, I understand everyone's going through has a very different situation at home, right? But running the coalition and getting Array ready for online and retooling it, and all this kind of stuff, I'm like, where do people find downtime? I'm so busy, and it was like, and if anything, there's so many things that you could be learning right now, whether it's a new skill, like it doesn't have to be technology, sewing or crocheting or, and so, one of the things that you can do to kind of get started in coding, there is a ton of free resources out there right now. One of my kind of favorites, like if you wanted to start learning just like the bare bones basics, there's a website called codeacademy.com. It's free. And they will kind of walk you through the basics of HTML and CSS. Those are the languages that we use to build websites. Code Academy is a great starting point. Another one that's also very good is codehs.com. So if you're in high school, they have some really great free resources on learning how to think like a computer, those kind of things. Obviously, YouTube, just be careful. I mean, you can just got to find one that has a high amount of ratings and views. But really, everything that you need to actually use to start learning how to code is free. So like there's a thing called a coding editor, right? It's like a text editor where you write your code. The one that we use here at Array is called Microsoft Visual Code. It's free. You download that. You go to Code Academy, free lessons, video lessons. You get to write code. It's free. You don't need $1 to be able to start learning this stuff.
Awesome. Thank you.
I'll chime in on another, I'm a former coder myself. I'll chime in on another opportunity that was brought to my attention, which is Stanford is offering Intro to Computer Science. They're coding in Python for free. It's a 5-week program. If you want more information about that, reach out to me. It is only open to 18 plus, but you have a TA and it's a legit Stanford class. Kind of a cool opportunity if you're looking to get into it and not sure where to start.
Awesome. Any other questions from youth for ET about technology or the coalition or Array? We'll kind of give maybe last round of a chance for folks to ask questions, and maybe ET, if anyone's chiming in or typing in, what's your encouragement for helping all of us stay motivated and stay kind of heads up to what's happening around us, but also staying positive and kind of building the Wyoming that we want to live in? Give us your motivational speech as we sort of wrap up.
So a bunch of people have been saying, and some of you may have seen it on social media too, like when we go through these crises, it's very easy to be depressed and have high anxiety and depression. And one of the things that we've talked about, like if you've kind of struggled with those in the past, which I have, a lot of people have, right? Being isolated and staying at home is not making anything better, right? And someone sent me a quote from Mr. Rogers, and it's like, in these dark times, look for the helpers, right? Look for those people that are actually helping, and then ask yourself the question, how can I help them, right? Because there is positive, and I did post on Ray's Facebook thing, which is absolutely insane. We had like over 1,200 likes on this, like, we're calling it #wizard wisdom. And the reason we call it wizard, as I posted a picture of, because I am a huge Harry Potter fan. So we posted this picture of Dumbledore. And one of the things when everything was seeming like super dark in Harry Potter, there's this wonderful quote, and it just says, happiness can be found in the darkest of times if only one remembers to turn on the light. So think about that. There's a light switch on each of your walls. Turn it on, even during this dark time. And then the last one of our wizard wisdom was from Gandalf from Lord of the Rings. And one of the quotes was, Frodo says to Gandalf, I wish it need not have happened in my time. So do I, said Gandalf, and so do all who live to see such times. But that is not for them to decide. All we have to do is decide what to do with the time that is given us. And that's so true right now. You know, like we all don't want to live through these times. All we can do is decide to do with the time that is given to us. And, you know, my focus obviously is how can I help? How can we build a coalition? How can we use technology to go and to walk away from this feeling really good? So find the helpers. Ask yourself what you're doing during this time. And then realize that you guys as future leaders of Wyoming, you know, I left Wyoming and I came back. One of the most amazing things about this state is once you start getting involved, you can make significant change here very, very fast. And that's, you know, like I wanted out, but when I came back, I can't believe the amount of people in this state that are willing to help. And that's the advantage of us living in the smallest populated state in the country, right? Is everyone knows everyone, you know, like you guys met the governor, you know, last week. Do you understand how difficult that would be in any other state, especially right now during the COVID-19 crisis, to be able to take an hour of their time out of the day to talk to their youth? It doesn't happen. It's not normal. It's not natural in other states. What we're doing in Wyoming is very different. And so we, as Wyoming, we can act very fast, and you guys should become future leaders. Get involved in your city councils and coalitions and be a part of it, because that's the thing I've enjoyed most about being back in Wyoming. Of course, I miss, you know, all the fun things that I used to do in New York City and Chicago and all that stuff. But I think the most thing that has kept me alive here is how fastly you can impact change and feel like when you go to bed at night, you made a difference. You can do that here in Wyoming, and we're the one state in the country that you can probably do it the fastest. So get involved. You should be really thankful to live in such a great state.
Awesome. Thank you, ET. Round of applause for ET. Awesome. I'm going to go. Okay, great.
Quickly reiterate, just for the kids here who might want to get involved. I know a lot of kids are on spring break right now. If they go to WTCC.com, is that sort of a good jumping off point for where to go next?
Yeah, I would say just start at wytechcc.com, fill out like a little join now thing, and I'll take a look at that. And then really think about, you know, if this is a subject area that you're passionate about, Array might be a good fit for you. It might not be a good fit for you, but we did launch a new apprenticeship program. So we have 0 tuition at Array. And we'll pay you starting $15 an hour to start learning computer science. And we start that this fall. So I think we are the first school in the country, or a handful of them, that we launched that, of course, right before COVID-19. So we want to make sure that anyone that has access or wants to learn this stuff, not only can you come learn it, but we'll also pay you to learn it.
Awesome.
Awesome.
That's very cool.
Thank you all for joining again this week, and we'll keep these up on Thursdays. And if you have ideas of speakers you want to hear or topics you want to discuss, give a shout to Michelle or myself. We also have a page now on the Leadership Wyoming website. It's just leadershipwyoming.org/youth connection. And so you can also register there or kind of see what's coming up there. And we'll also keep sending it out via email and social media. So tell your friends, tell your classmates. It's 1 hour of the week that you can engage with folks all across the state and hear about some pretty exciting things. So thank you for being here, ET. Thank you for your time. And we hope you all have a really awesome day. And we'll see you again next week.
All right. Bye, everyone.